So Robert drowned in 2018. We were largely on the road seeking therapy for basically a full year. When we got home in 2019, I believe, I approached a friend of mine who's on the board of our local hospital district and asked if I could make a presentation, if I could present Robert's case to the hospital district and make a pitch for treating reperfusion injury in the hyperbaric chamber. We have a hyperbaric chamber in our county. The hospital district runs the ambulances and the emergency rooms. So I was granted that opportunity. The day that I showed up to present, the medical director for our local hospital district came into the room, and before I could even make my presentation, informed me that he had checked Cochrane's, that there was no scientific basis for hyperbaric treatment for reperfusion injury, and that I could take this voodoo medicine back to New Orleans where it belonged. I looked at my friend who was a director, and I looked at him and I said, should I even continue to make this presentation, seeing how it's going to be received? And he told me, no, I could continue making the presentation. He left shortly after the end of it, but one of the other medical people that was in the room at the time did approach me afterwards and said, so what you're saying is every heart attack, every stroke, every drowning, all the reperfusion injuries should go straight to the hospital that has a hyperbaric chamber. And I said, you got it, on the nose. None of that has changed. Their protocols have not changed. Their approach to it has not changed. But once again, we've tried to present the information using Robert as another sample of undeniable evidence that this works. And the sooner you can get it, the better. So if we could get it in the ambulance, if we can get it in the emergency room, if we can get it in the first couple days in the intensive care unit, it's not just drowned kids, it's heart attacks and stroke. Anytime that you've lost blood flow and it comes back with that destructive inflammation, and we have to stop that inflammation.
What do you think about that, Dr. Harch?
That voodoo term, it's a common one you hear. And what the translation of that is an ignorant doctor. It's voodoo to him because he does not understand it. He has no knowledge of the science. And that was what one of our pulmonologists, critical care doctors, used to describe this many times, beginning in around 2002 or so, as voodoo medicine. And that is deeply ingrained in my generation of doctors. Again, the root of it is ignorance. He has no idea. I've been writing a chapter and summarizing the world's literature on this for 24 years. The last edition of the textbook was in 2017. And actually, I take it back now. It's 27 years, excuse me. The last edition was in 2017. The amount of animal studies and now increasing human literature on treatment of acute emergent injury, hypoxic ischemic injury to the brain, anoxic injury, is amazing. And it all goes to the basic underlying science of what we're treating. And it's in animals, it's in humans, it's in different species, doesn't matter. It is treating the underlying injury process. And hyperbaric therapy, increase in pressure and oxygen, does this generically. Voodoo, all that says is how ignorant that guy is. And what he's doing is just parroting a phrase that's been used ignorantly now for many decades.
That chapter and the other chapter that Dr. Harch edits in the textbook of hyperbaric medicine were two of the documents that I presented to the hospital staff that treated Robert as more undeniable evidence that, here, read this, because it's not something you're going to plow through in a couple of hours. It's going to take you a series of evenings of reading to get through all of the data, especially if you try to internalize the number of studies that have been done. It's overwhelming. And
what's your...
Yeah, it's funny. If you're starving, you're given food. If you're dying of thirst, you're given water. If you have a lack of oxygen in your blood, and it's measurable, you're given oxygen. But if you have a lack of oxygen in your brain, you're not given oxygen. Or a lack of oxygen in your heart, you're not given oxygen. And to reach those organs, you need pressure to do it. And the odd thing about this, I wanted to put this in my book, and the editor and publisher said, no, you can't do that. It's too offensive. But I've had a little saying all these years, this is so immediately obvious to any person, any lay person. It's only doctors don't get it. And part of the problem is what we have been told. Our minds have been polluted by the inability to explain this therapy scientifically. And as a result, my generation of doctors just cannot understand this. And it's viewed as voodoo. but it's pretty obvious. Robert's case alone, just one case treated like this, immediately shatters the whole prediction in principle that there's nothing you can do and that no child is going to have a good outcome. One case alone argues that you ought to at least try that on everyone, because the known result is what it is. Severe neurological injury, disability, and at most an incremental improvement over years and years' time. They all end up in category, 5 and 6 of one of the scales that's used for outcomes in children.
Back to Dr. Harch's point about we should be trying it, the risk profile is so low that there's no reason not to try it. If 80% of the patients respond positively, great. The other 20 didn't respond positively, but you did nothing to hurt them. So why wouldn't we try it with everybody?